Recording in progress.
So what is high blood pressure? If you look at the diagram in front of you, you're going to see clearly your artery. Your artery plays an important role in the definition of a high blood pressure or hypertension. Now, kindly look at the diagram. You're going to see where I wrote clearly force of blood on artery wall, and I've indicated it by showing the arrow points. So if we are to define hypertension, we will be saying that the force of blood that passes through your artery wall, when it is high, then definitely we are looking at a situation where your pressure becomes high. Please pay attention closely. I said hypertension is also known as high blood pressure or vice versa. It's a condition where the force of blood pushing against the artery wall is consistently too high. So if the force of blood that is passing through the artery wall is always high or always forceful, then it tends to take your pressure up, that is the blood pressure up. One thing with hypertension is that it is a very, very serious medical condition. Very, very serious medical condition because it increases the risk of various diseases, including heart disease, stroke, kidney disease, as well as several health problems. I'd like us to go back to that diagram again so that we understand something clearly from it. Let's look at the diagram. Usually when your heart beats, the pressure of the blood within the artery is measured by the beats. So the measurement for your beat is taken in dual forms. We have the systolic number as well as the diastolic number. Usually the systolic number is usually the number on top, while the diastolic is the number below. When you go for a BP check, you find the nurse or the medical personnel telling you the value of the pressure of blood within the artery walls of your heart. So once they give you the value, then they tell you, look, it is within normal range. Some they tell you it is a bit high, some they tell you it is high. Some you're requested to come back and see the doctor again for a recheck. Now, a systolic number is measured when the heart contracts. So the machine measures the blood pressure within the artery when the heart contracts. So the value that comes from when the heart contracts is the one we refer to as the systolic number, while the diastolic, the one down, is when the heart relaxes. So the measuring, the sphygmomanometer measures the heart when it relaxes, and that gives you the value that we refer to as the diastolic number. So medically, when we are looking at the normal range for blood pressure or for blood pressure, we measure it as 130/80, 130/80, and anything greater than that, we begin to suspect that something might be wrong. But most times it depends on the age of the patient, because if you go to the British medical school, for instance, they tell you 100 plus the person's age over 50 plus the person's age. That's how they measure the limit, the maximum limit the person can endure. So it varies from age to age. So if somebody is 70 years, for instance, definitely the maximum for his blood pressure might be 170, and the maximum could be 50, that's around 120, which is maximum that the person can endure. So we look at this maximum, but for a normal range that the medical personnel are often after or look look for is a 130/80. Anything less than that will be far better for the patient. Now, blood pressure is the measurement of the pressure of force of blood pushing against your blood vessels. I've told you that. I've equally told you that the readings has two numbers. I've told you the top as well as the bottom. And I said that the pressure the person experiences can be determined by age. You find out that certain people's pressure go up as a result of their age going up. Some have high blood pressure of genetics, that is, it is genetically linked. For some patients, it is because of their weight. So we are looking at some of the predisposing causes. Some is as a result of their weight, some are obese or overweight. Some have high blood pressure because they are not physically active, while some have high blood pressure because they have high salt diet or taking lots of salt, while some have high blood pressure because they take too much of alcohol. So let me just run through it again. People develop high blood pressure because of their age as they grow older. Some it is genetically related, some it is because of their weight, some is because they are not physically active, some is because of the salt in their diet being too high, while others is because they take too much of alcohol. So if we are to go back to the numbers I gave you earlier, I said the top number, the systolic pressure, should fall at least on 130 or less, and the bottom should be 80 or less. Now, usually pressure is measured at mmHg, that is millimeters of mercury. And that is why they tell you it is 130, for instance, mmHg over 80 mmHg. So it's millimeter of mercury. Now, you'll find the top number could, for an adult, could still go as high as 140, while for the diastolic, it could go as high as 90, but at that level, the nurse or the medical personnel will be concerned and might require that you come back for further check. I don't know, for all of you listening to me this evening, I don't know when last you did a BP check. I will want to advise that at least every week you carry out a BP check. For some of you listening to me, I'm sure you're not comfortable with your last result, with the last result you got with respect to your BP check. And that is why today's lecture is coming to us very handy. Now, why is it a concern? Why is high blood pressure or hypertension a concern to us? The reason why it is a concern to us is because it can increase the risk of cardiovascular diseases. It increases the risk of what? Cardiovascular diseases. Hypertension is a major risk factor for heart attack. And recently, in our country, our dear country, Nigeria, we've been having high incidence rate of high attack. The prevalence of high attack has really gone wide. The issue of stroke too has equally has gone wide and is going up on a monthly basis. If you look at the data that is before us, heart failure is there. So the issue of high blood pressure or hypertension can increase this, bring about these risk factors. And we are having this lecture to see how we can prevent as many people as possible from developing either a heart attack, stroke, or heart failure, or any other cardiovascular disease. Now, another concern that we must present in today's class is that hypertension is really not good, or high blood pressure is really not good. Why? Because it can lead to kidney damage. High blood pressure can lead to what? Kidney damage. And you know, our country, when it comes to people not having good kidneys, you can see the stress they go through. Why? Because to get a kidney transplant now, it will require millions of naira, millions and millions of naira. Most times, you'll be requested or required to go abroad, let alone the dialysis that you have to be doing even before a major operation can be carried out is still not cost effective. So why stand the risk of getting a kidney damage by allowing yourself have hypertension? So that's why there's strong need for us to constantly check. And once you find any glimpse that it has gone up, the necessary appropriate measure has to be taken to ensure it goes back to being normal again. Then another concern that we have with the issue of hypertension is that once you are constantly exposed or having this constant high pressure in your blood vessels, it can lead to vision loss or vision impairment. So it can damage the blood vessels in the eye, and that can ultimately lead to vision loss. A lot of people that have developed severe eye problems is as a result of not checking the pressure within the blood vessels, constantly being high and they not checking. Because one thing with hypertension or high blood pressure is that it is a silent killer. It will not warn you. It will not warn you. You will not know. You think it's malaria you are having. You think it is headache you are having. You just think maybe it is a typhoid you are having. Meanwhile, you might not link any of these signs and symptoms that you may be having to it. You might just continue month in, month out, going about your normal daily activity, not knowing that your pressure, the blood pressure in your blood vessels or arteries have gone up. So please, there will be strong need for us to make it a duty every week to ensure we check our blood pressure. Then another thing it does is that it brings about cognitive decline. Hypertension is linked to an increased risk of cognitive decline, and that ultimately can lead to dementia, loss of memory. That's why you find certain people at an older age, you find them finding it difficult to remember things, and you need to remind them. So dementia begins to set in. Why? Because they've been having this back and forth high pressure within the heart region. Let's continue. Let's look at the global and Nigerian incidents. Globally, it is estimated that 1.28 billion adults whose age range from 30 to 79 years worldwide have hypertension. So if you look at these statistics from WHO, it is quite alarming. 1.28 billion age 30 to 79. That includes, very soon we'll be looking at the Nigerian situation to 79, developing hypertension. You should know that hypertension is no friend to any adult. It's no friend to any adult. So we must take time to do a constant check. Now, one statistic that is really frightening when I was looking at it is that out of this number, 46% of the adults with hypertension are unaware that they have the condition. That out of this 1.28 billion people, 46% of this number. So if you do a 46%, that's 46 over 100 times 1.28 billion. You are going to see the values. You are going to see that the number is quite large. This number of persons do not even know that they have hypertension. It's just like some of you listening to me here. You cannot even remember the last time you do a BP check. So that means you might be having high BP as you're listening to me, and yet you do not know. For most of you that are engaged in severe alcohol intake and so many other things that can predispose you to this condition, you are listening to me now and might not even know you have high blood pressure. So there is need for us to do a check. Let's look at, if you look at the diagram in front of you, you are going to see an incident that was done in 2010, 2015, and a projection for 2040. Now, if you look at the color red, you are going to see, take for instance, the Russian enclave. For those who are familiar with geography, you are going to see clearly here that as far back as 2010, this European region tend to have high prevalence of people with high blood pressure. By 2015, it was still there. And by 2040, it is expected that it would have reduced to medium. Why? Because they are taking uh, actions, health actions, to ensure that lesser people within their country develop high blood pressure. Why? They are making the conditions suitable, the environmental conditions suitable, work conditions suitable, in order to reduce the rate at which people develop high blood pressure. In our case, Nigeria is still within the medium bracket, but from all indication, what is being projected on ground is frightening. It is frightening. Why? Because the prevalence of hypertension in Nigeria is still high and is increasing. What we see on ground is not helping matters. It is projected that by 2040, it is expected that our hypertension should reduce, but rather government policies is now making it to go up. This projection was done in 2010. Now, if you look at what or how we lived in 2010 compared to how we are living in 2025, you can see justifiable reasons why blood pressure in Nigeria tends to be going up. It is estimated that in Nigeria we have between 27 to 38.1% of our people living with high blood pressure. So you can see it is a very, very serious matter. Though if you look at the 6 geopolitical zones here in Nigeria, it varies from zone to zone. It varies from zone to zone, with the southeast and south-south region having or reporting. So research done on hypertension in Nigeria tends to suggest that the southeast and south-south region tends to have more higher BP rates than the northwest and north central. So at least some of you listening to me that are from this area, please do your best to ensure that you do a check. What are the symptoms and causes? What are the symptoms and causes? Just like I said earlier, hypertension is a silent killer. Why? Because you can have it for years and yet you do not know. That is why it is called a silent killer. When your blood pressure is, say, 180 over 120, for instance, then something is seriously wrong. Why? Because it begins to give you symptoms like headache, heart palpitations, nosebleeds, and so many others. You begin to have hypertensive crisis that requires medical care. They will not want you to get to that state. That is why we are suggesting in our class today that you see how frightening this issue of BP is, so that you begin to look at your health. What are the different types of high blood pressure? Let's look at the different types of high blood pressure. Number one, we have primary hypertension. Primary hypertension, or what we refer to as essential hypertension. Now, this particular type of hypertension is high blood pressure with no identifiable underlying cause or causes. And it is the most common type of hypertension, accounting for the vast majority of the cases we see in the hospital today. Why? Because it is not traceable what has triggered it. As we're going to see later, we're going to see reasons why in some people's case, they cannot even explain why their BP went up. Why? Because they may have been doing the necessary right things, but for no reason clear to them, their BP is still up. So most times we could still link it to lifestyle factors, or sometimes we say it could be genetically caused. Why? Because the doctors cannot link it to a particular, trace it to a particular thing that the patient is doing, because the patient is doing everything right, but the BP is still up. So we refer to this as primary hypertension. Now, if you look at, we're still going to go to secondary hypertension, but if you look at the table in front of you, you are going to see classification of blood pressure for adults. You see normal when the systolic is less than 120 and diastolic is less than 80. Now, when the systolic is 120 to 129 and the diastolic is 80, we say we are looking at a pre-hypertensive case here. Then when it is 130 to 139, then the diastolic is 80 to 89. We are looking at hypertension stage 1. Then when it is 140 or higher, 90 or higher for the diastolic, we are looking at hypertension stage 2. Now we now see hypertensive crisis. These ones are the ones that the systolic is higher than 180 and the diastolic is higher than 120. So now, as we have this at the back of our minds, let's continue and look at secondary hypertension. Secondary hypertension is the high blood pressure that occurs within the blood vessels, but in this case, it has an identifiable cause. It has an identifiable cause. Probably the person is a notorious alcohol taker, or the person is a notorious having excess substance that we have enumerated before. So once, or the person is obese, his weight is so glaring that he is obese. So when we begin to see this clear identifiable cause of causes and the person has high BP, then we know that we are looking at a secondary hypertension. Now, there are situations we see in the hospitals that we tend to give hypertension some other names too, that it will be necessary for me to present in this evening's class. Now, we've seen cases. I have this pastor friend of mine, or one of my pastors back there. Whenever he's at home, his BP is always normal. Then whenever they decide to put the BP stick on his hand to check, he begins to develop an elevated BP. Meanwhile, on a normal scale, his BP is always normal. But once he sees the machine, his BP goes up. So we have people with a normal BP at home, but when they get to the hospital, they now record an elevated BP. So people like that, medically will refer to them as, or refer to their condition as white coat hypertension. Why? Let somebody mute the person that is just coming in. So at home, they have normal BP, but once they get to the hospital setting and do a check on them, we find them having an elevated BP. Now, we have another one we refer to as the maxed hypertension. Maxed hypertension, where the person's BP is normal when he or she gets to an healthcare center, but when the person comes home, his BP is up. In a healthcare center, the BP is normal, but at home, the person's BP is elevated. So a situation like this is referred to as maxed hypertension. Then we equally see others too that tend to have what we refer to as sustained hypertension, where the BP is elevated both in a healthcare setting and at home. So by the time you check it at home, it's high. The person goes to the hospital to check, it's still high. So in this particular case, we are looking at a sustained hypertension. Then we now have cases where the person's BP only goes up when the person is sleeping. The BP only goes up when the person is sleeping. So in this case, we are looking at nocturnal hypertension. Nocturnal hypertension. Now, in either case, the medical personnel know how to handle any of this. So it is not something that should scare you. If you're listening to me, it's not something that should scare you. Please know that whatever the case might be, the medical personnel can handle it. So one thing we must let all of you know here is that alcohol intake, high salt intake, lack of physical activities can lead to these different types of hypertension. Then diseases can equally create situations for you that can make a patient's primary hypertension become secondary. diseases like somebody who's having obstructive sleep apnea, and so many other diseases like Crohn's disease or renal artery stenosis, and so many other kidney diseases, for instance. And some people who are used to drugs like cocaine, Indian hemp, and the rest, they stand a chance if they have primary hypertension of developing secondary hypertension as a result of their lifestyle choices or as a result of the presence of a disease condition. So, in a nutshell, you have these various disease conditions, adding up to the challenge of one, your age, two, the family you're coming out from, because in some families it is genetic in the sense that has had it, and one or two persons in that lineage is now having it. And one thing with high blood pressure is more is high when you are black and going through the kind of challenges we see in our third world. So please take note that all of these factors that can lead to the high blood pressure, if you can stay away from them, then you stand a better chance of remaining healthy. So I keep on saying this. If you're obese, try and see how you get yourself involved in exercise in order to reduce your weight. Two, if you're smoking or if you're into drugs, stop it. If you're taking alcohol, please, if you can stop the quantity of bottles you take, see how you can reduce it. If you can't stop it outrightly, see how you can reduce it. But it will do you good if you stop taking alcohol. It will do you good. Why? Because you prevent yourself from developing other medical conditions that can lead you into developing secondary hypertension. I've mentioned some of those diseases and I don't want to go back there. And don't forget, we don't want you to go blind. Yet again, we still have our people not paying attention. I believe I've done justice to the preliminary explanation on how you can have hypertension. And I believe you now know the values we refer to as being normal and the values that we believe will lead to stage 1, stage 2, and a more dangerous level of hypertension. You now know it from today's class. You now know what to do in order for your BP not to go up. And if your BP has gone up, you now know what to do to bring it down. So at this point, I want to invite my firm to take us through the diagnosis and the test for high blood pressure. Then if Dr. Chuk's around or our coach, Coach Samson, will take us through the treatment with our Super Life products. So once again, thank you for paying attention and listening. Fam, are you there? Hello, Fam.
Yeah, I think Farm is around. Farm, can you unmute? Please, can we just appreciate the doc on the chat room? He really exposed, we always assume that hypertension is a minor thing, but you could see the other issues that can is underlying health condition that other major health issue can leverage on. So as we are appreciating Dr. Chooks, please can we welcome Fam Chilaka? We have already congratulated him in absentia. The family of Fam Chilaka welcome a newborn baby. That's why for some time, weeks now, we just do Omugo. So can we please welcome him? He's back. So thank God for the new baby, the best gift of the year. So yeah, Fam, yeah, welcome, Fam.
Yeah, thank you very much, sir. Good evening, sir.
Good evening. You're welcome.
Good evening, everybody.
Mommy and baby.
Yeah, doing fine. Give us glory.
Good. Thank God. Thank God. You're welcome.
Thank you very much. Thank you, Prof, for that powerful lecture on the hypertension management. It is, in fact, it is something we should be discussing every day, considering the prevalence of high blood pressure being an underlying cause of a lot of health problems, especially cardiovascular issues and even renal. So when you go to the hospital, there's what we call comorbidities. Comorbidities are co-associative diseases that you can hardly have one existing alone. For example, where the patient has some underlying cardiovascular issues, let's say a myocardial infarction, or the patient is having some other heart issues, as the case may be. Most of the time, we usually have other organs being affected, organs like the kidney, especially, or even the lungs, or sometimes the brain, right? And so it is important that we take this lecture very, 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 very seriously. Okay. All the important points have been noted by Prof, so I don't need to dwell on that. So how do you diagnose high blood pressure? How is hypertension diagnosed at the hospital? And so basically, because of the importance of high blood pressure or your blood pressure, when you go to the hospital, part of your vitals that the nurses would do is to check your blood pressure. And the reason is not far-fetched, just like I've said earlier, that it is important that your blood pressure is known. As a matter of fact, for an elderly, even a young person who is above 35 years and 40 years, it's important you have that machine in your house to check your blood pressure periodically. You understand? So let's get on that. So basically, when you go to the hospital, the HCP would basically measure your BP, right? Of course, you know the handcuff that we normally use at the hospital, the one they will tie around your arm, and then he takes the reading. Sometimes we'll do that to also check your pulse. He can also manually can place his hand, right, on the edge of your wrist, right, to get the pulse. So when he does that, your BP is measured. Now, the reason why it's important that part of your vitals, the BP is properly taken care of or well known, is because beyond the fact that you have high blood pressure being implicated in a lot of cardiovascular cases and other internal medicine issues, there are also indications where you have the blood pressure being also implicated in some infections, like even malaria. Do you understand? Like even malaria, and if some other bacterial infections, as the case may be. So it's a very, very important thing to do. Now, if you have a high blood pressure, upon checking your blood pressure, and the readings shows that your blood pressure is above normal. Now, the readings, the values to indicate whether the patient's blood pressure is high or normal would also depend on the particular standard the doctor is using. In this case, in Nigeria, we usually follow the European Medical Association as well as the American Cardiology Association, ACA. And from what the prof read earlier, you would see that once the blood pressure is getting to 130, because before 2020, right, it used to be when it's above 140. When the blood pressure is above 140, and then you can say it is elevated or it is a bit high, right? Say the person is normotensive, or the person's blood pressure is now elevated. But we have seen cases where the blood pressure is even lower than that, and before you know it, other severe cases could arise, right? It is on that regard they realize that, okay, why do we wait until the blood pressure is 140 and above before we can start taking drastic measures to managing that situation. And so now when the blood pressure is even at 130, it's cause for concern. When it's even above 130, it's cause for concern. They want to quickly get into action and see how they can quickly, bring it down to normal. So we don't have to wait until it rises to 140. Okay. So by the time you go and do the checkup repeatedly, at least 3 times, and that is why for each time you are checking your BP, you do it twice. You do the first one and the second one. The reason is because sometimes you just want to confirm the sensitivity of the machine, right? To be sure that it is not problematic, because we have seen cases where a machine that is not so good is used, and the patient is confirmed hypertensive, whereas the patient is not. And just like Prof said, some people, by the time they see their readings and see their results, and they say the blood pressure is higher than normal, they start getting scared, and before you know it, the person's blood pressure may now become elevated. So that is why we sometimes want to do it twice, right? And ensure that the person is also very relaxed. The person is very relaxed, so that if you walked, perhaps you went to the hospital, or you went to the hospital where you had to climb the staircase, there's a high tendency your blood pressure will be elevated. And so you may have to relax and sit down for a while, for like 20 to 30 minutes before you can run that test. All right. 1 minute, please. Okay, so blood pressure categories. In 2017, the American College of Cardiology and the American Heart Association issued new blood pressure guidelines. The healthcare providers in the US use these guidelines when diagnosing and treating high blood pressure. I think I've said something like this. So can you, if you can show me the next slide that shows the chart, right? Yeah, exactly. So if the blood pressure is less than 120, of course the person is we can say the person has a normal blood pressure. That's a normal blood pressure. All right. When it's below, when it's 120 and below, that is very perfect. Right. That is for the systolic. If it's 120, and if the diastolic is also between 80 and 65. Right. That's perfect. That's perfect. That's perfect. And then if you have it at 120 to 129, now before now, 120 to 129 is also seen to be normal. So the range used to be 120 to 129 is meant to be normal. But nowadays, since that update by American Cardiology Association, right? We are not saying that once the blood pressure has even risen above or between 120 and 129, it is already termed elevated. Now, when it is termed elevated, it means that the HCP is meant to take note of that. If the patient keeps having the blood pressure around this borderline repeatedly, especially in an increasing rate, for example, if week 1 you went to the hospital or you check your BP and you're seeing 125, week 2 you go again and then the average is 127, week 3 you go again and the average is 129. You see, you don't have to wait until week 5 or week 10, because there's a high tendency that by the time you go there week 10, right, the blood pressure may have risen above 140. So by the time you look at that track record, you look at the trajectory of the results, right? If the readings are increasing in an increasing rate, even if it is still below 130, it also calls for concern. It's something the HCP will want to look at. So if it is the GP that is managing your case, a general practitioner that you have in family medicine department, most of us that visit general hospitals, you most likely will find the GP. The GPs are the class or the classes of doctors you meet firsthand when you visit a hospital. When you go through the general, the GOPD, you are going to see a GP. The GP is not an internist, right? Is not a internal medicine specialist. The GP is not a specialist. So it is upon seeing the GP and the GP notices that your BP is being elevated, is an elevated scale, especially when it's not even crossing 130. Then he may have to also subject you to other kind of tests. And those tests will also now determine the units they will refer you to, whether to go see a cardiologist or you're going to see an endocrinologist, or perhaps you're going to be visiting various units at different times. Because I mentioned comorbidities, right? That most of these cases are associative. So you could be managing, you could be managing a cardio case, and at the same time, you may also have an endocrine case. I mean, if you have your kidney affected, maybe seeing an endocrinologist whilst you are also visiting a cardiologist, right? My prayer is that none of us will get to that state in Jesus' name. Okay, still go back to that previous slide, sir. Fine, thank you, sir. So the stage 1, right? That is 130 to 139, and stage 2. The stage 1 and stage 2, all right, at this point, at the stage of the stage 2, the patient can be confirmed hypertensive. Now, you are not classified hypertensive if you go check this for the first time and you see your blood pressure reading showing above 140. No, it has to be on regular basis. You must have done it 3 to 5 checks, especially at different times. And you keep seeing the numbers being at that level or even higher than previous, right? Then the patient can be classified as a hypertensive subject. Okay, so let's go to the next slide. Thank you, sir. Next slide. Thank you. Yeah, thank you, sir. So how do we manage or treat high blood pressure, right? Now, there are quite a number of treatments plans or treatment regimen, as the case may be. Especially, it also depends again on the stage of that blood pressure. If it is quite high, you know, that will also determine what kind of treatment plan or even medications that the HCP may want to adopt. But in any case, a lot of times, what causes blood pressure could have been avoided or prevented. Right now, like I said, the blood pressure, it's I know Prof has explained that vividly while he was taking us. It is not out of place to have an elevated blood pressure, especially at random. It is not out of place. A lot of reasons could contribute to it, but it is when there is a persistent and irregular elevation in the patient's blood pressure, that is when it becomes a concern. Now, the way God has designed the human body is such that no matter what the external pressure would be, right, the body has a way of regulating, we call it homeostasis, regulating itself and ensuring that the blood pressure is within range. Now, but the activities of men, I'm referring to our lifestyle. And lifestyle here also includes the type of food that we eat. These things go a long way in affecting our blood pressure. Right? Now, so basically, what the HCPB, by the time he's clacking, asking you some questions, he also wants to know your lifestyle. Are you docile? Do you live a sedentary life? You just sit down from office to home, sit down in your car. You know, what are the kinds of food that you eat? How much time do you spend sleeping? Do you have rest? You know, what type of rest do you have? What kinds of food do you eat? How often do you eat? Do you smoke? Do you take alcohol? How often do you take alcohol? Yeah. Do you, in fact, in recent times, you know, we have what we call personalized medicine. Do you have issues, mental issues, psychological issues? Do you have issues of unforgiveness? Because studies have shown that over 38% of patients that have cardio issues have been found to battle with unforgiveness. Do you have someone in your life that you have not forgiven or that you're having issues with? Are you battling with divorce? These questions, you might think they are personal, but the doctor will want to, a good consultant will ask this kind of questions to get into the root. Because if you are able to solve the cause of this problem, the high blood pressure may naturally die on its own with little or no chemotherapy, little or no pharmaceutical measures. The high blood pressure will just be arrested. So that is why he wants to look at your lifestyle so that they will know whether to tell you to start some things or do some things. Now, here are some proven ways to lower your blood pressure. Number one is to keep a healthy weight. There is a very high relationship between the body weight and high blood pressure. It is a no-brainer. Patients that have, high body weight, patients that are obese are usually very, very predisposed to atherosclerosis. You cannot separate that. In fact, one of the first tests they will do, the vitals there, is to check your body weight. When your body weight, I think I gave us a calculation some time ago. If your body weight exceeds certain number vis-a-vis your age, right, and your height, it's a no-brainer. It's you are more likely going to have an elevated or a high blood pressure. And so if your body weight is higher than normal, the measures that will be taken would be measures that will help you reduce your body weight, right? And that includes physical exercise. And then number two is a healthy diet. A healthy diet. I will call it and DASH. What is DASH? DASH is if I can remember, is a dietary, we call it dietary approaches to stop hypertension. DASH. Dietary approaches to stop hypertension. That's DASH. Now we have certain kinds of foods that are hypertensive or hypertension friendly. What I mean is they are very good at elevating your blood pressure. A lot of the foods we eat, let me shock us, a lot of the foods we eat are just agents of high blood pressure. Unfortunately, there is little or not so much we can do, because even now we are hearing the GMOs, the genetically modified organisms or genetically modified crops, they are talking about now. Well, maybe not as it's been propagated, right? But there are also concerns, ethical concerns that we need to look at. A lot of the foods that our forefathers or our fathers, the villages, they eat, we don't eat them anymore. And even the ones that we eat, those ones that we eat are even genetically modified. Some of them are highly processed. Do you know the rice we eat is not do you know that rice they call father rice? That is the best form of rice. This white rice we eat is polished. Rice is not right. Rice is brown. But it is polished to give it that white coloration. And all these things have an effect. But the truth is this, I don't know, how would you want to eat? How do you want to have access to those natural foods all the time? So you are living in the city, you are living in Lagos. You have no choice than to, but but the essence of this lecture is to also get this information and see how we can curb on some of these over processed foods. You want to eat tomatoes, you cannot buy the fresh tomatoes and grind it or something. You buy tin tomatoes. Any of these foods that you have in cans and packages have been processed with preservatives. And a lot of these preservatives are chemicals that are not biologically friendly. They have a very strong negative effect on our cells. And whether you like it or not, they have an interplay with increasing the blood pressure of humans. A lot of these chemicals have been found to be carcinogenic. And so when you go to cities and countries where the life expectancy of people is quite high, like Japan and some countries in Asia, South Asia, a lot of these people have been found to eat natural foods. Natural foods, not these over-processed foods that we eat. Okay, so healthy diet is key. You need to watch your diet. Watch your diet. Watch the kinds of food that you eat. We don't have all the time to start telling us the type of food. You can Google them and you see you meet a nutritionist. They show you the kind of food. And but these foods, they are naturally available. You have these leaves around us, but we don't eat them. You have the ugu leaves, you have the bitter leaves. These are nice leaves that we can use to make our meals. We have the scent leaves rather than using the mangi or all this seasoning and all those chemicals they give you as seasoners. You can use the scent leaf. It's natural, right? And then you cut down on salt intake. Why didn't you cut down on salt intake? Of course, salt is sodium. Salt is sodium. I think Prof mentioned it. Now, there is a relationship between sodium and calcium, and also potassium and calcium. Now, the higher the calcium is a major cause of hypertension. When the calcium level in the cell, in the cytosol, is higher than normal, it's been found it will increase the blood pressure automatically. And so there is an electrolyte balance that goes on to ensure that as potassium is coming in, calcium is going out. There is this stability that the cell must ensure, that at no point is the calcium level higher than normal. Because if the calcium level is higher, right, then you're going to have an increased blood pressure. The blood pressure will be elevated automatically. And so that's why we have one of the antihypertensives that you give to hypertensive patients, especially primary hypertension management, is the CABs, CCBs, calcium channel blockers. What they do is to go to that proton pump where the calcium is coming from and block that channel, so that calcium does not find entry into the cell. Because once calcium finds entry into the cell, you may have increased blood pressure. So you get enough potassium that will balance the calcium, and then exercise. You need aerobic exercise. Exercise as little as just walking. If you can get a skipping rope, you do the skipping exercise. It's a good cardio exercise. Skipping, walk. When you're at your office, please, for every 30 minutes, stand for 5 minutes. Don't sit down for a long time. For every 30 minutes, stand for at least 5 minutes. All right? Then you limit your alcoholic intake. Okay. So I don't know the next slide. Let's see the next slide as I round up here. Okay, thank you very much. So these are medications to manage. There are various classes, but these are the few major classes that we have. the ACEs, the ARBs, I don't think it's something we'll need to bother ourselves about, because this is dependent on the prerogative of the HCP. Like I said, most of the time, in managing high BP or managing high blood pressure, right? You usually have what we call diet therapy. I mean, you have 1 or 2, sometimes even 3 antihypertensives can be used at the same time, especially if it is a severe case, or if the hypertension has lasted for a long time. In most of the case,
Pam,
in most of the
Pam,
time, yeah,
Pam, well
I
done.
should round up.
Yeah,
I should round up,
I
right?
think I cited Dr. Chooks so that he will have some time to, network has been
Okay.
throwing some people out. I cited Dr. Chooks. I think
Okay, it's back
let's
on.
just
All right. Okay, so I'll just wrap it up here. So these are the various classes of antihypertensives that can be used to manage hypertension. So before I hand over to Dr. Chus, which I believe he would do justice to, I also wanted to mention some few things that we have on our Super Live STC 30 that have been found to
that's
be
the one.
beneficial. Okay, so let me leave the floor for Dr. Chus to handle that. Thank you very much.
Thank you. Please, can we go to the chat room and appreciate our farm? Wow, thank you so much. I think Dr. Chus is going to do justice, just wrap it up with the therapy of our Super Life. And before he takes over the floor, I've announced to the early bird partners that we'll be having Dr. Chooks next week, Friday, specifically on our TerraHas. In short, we shouldn't miss that coming Friday on the TerraHas. He did a wonderful, in short, the workshop we had on physical workshop we have with him on Wednesday. Last time he was in Lagos. That was what necessitated that we started pleading with him to come and give us a whole dose, a full workshop on TerraHas. So I believe God that he is going to talk about it as well, even as to wrap up with the therapy of Super Life in this topic we have tonight. Doc, you are welcome. I know that there are a lot now based on the manual review. The manual review, a lot. Thank you. Yeah. Are you there? You're welcome, sir.
Okay. Yeah. Good evening, sir.
Good evening, sir. You're welcome.
Good evening, pharmacist Chilaka and Dr. Rose.
Dr. Rose, yeah.
Very much for your effort. The pharmacist, thank you for your efforts trying to download knowledge for the people to know how to go about their business. I think the little thing I will say before I talk about Super Life is the major dynamics of the pathophysiology of hypertension. When we are using the American data to compare it to Nigerian environment, one of the risk factors for hypertension is race and ethnicity. And we believe that from research that hypertension is common to Blacks. So that is why you see the white, they pinch their values on that particular those values we were mentioning just now, from 110 to 119, from from 120 to 129 and the likes. Majorly, but in Nigeria, we still have that acceptance value that is when it's above 140 and above 90 consecutively, that we describe the person to be hypertensive. Because the race is very important. Our system here, because of our environment, has enabled us to gather some form of advantage in our immune system. That is why I see when the COVID came, we could resist it. We could resist the COVID. The blacks were able to resist COVID because our environment from what we eat and from the way we do things, have built up some resistance for us. So that is why those values could not be completely used in Nigeria. We still maintain that one we are using because we have studied over time people that are hypertensives that were under drugs and those that were not under drugs. The one that developed cardiovascular disease and the one that did not develop it. I've studied them. We're able to come up with that. It's good to see maintain that our value. Now for hypertension, our super life product, the stem cell ST30, the neuron care, super life neuron care SNC, and the coffee, we can use them for hypertensive treatment and management. Why? These products, apart from the nutritive, they are nutritive value. Super life products have nutritive value. And like from what the pharmacist was explaining yesterday, was basically hammering on lifestyle. I was very happy when he was hammering on lifestyle. So yes, but our super life products have nutritive value to help moderate our lifestyles, especially our eating habit. So some of the things we lack in some of the ordinary food we eat. Some of the food we eat, our normal rice, our normal bar, our normal yam, and all this. So some of the things we lack, we are able to get them from Super Life products, for supplementation from Super Life products. So like I was trying to talk about, if you have too much calcium, so taking Super Life will help regulate your calcium. If your body is having too much calcium, taking Super Life product like stem cell will help regulate that calcium. Super Life product will help to, supply potassium, because many people don't really know about potassium. If you have too low potassium, you will be predisposed to hypertension. If you have too much sodium, you'll be predisposed to hypertension. If you have too much calcium, you'll be predisposed to hypertension. So now, if you are taking Super Life products like stem cell, it will be able to, give supply in these areas, like having low potassium to help you, supply your potassium. If you are having too much calcium or sodium, it will help, regulate the hypercalcemia or hypernatremia. It will normalize it. So our Super Life product, apart from being stem cell to build cells, to regenerate cells, to normalize cells or invigorate cells, it also has nutritive package in disease management and treatment. So that is a very fundamental one. And for hypertensives, one of the management protocols for you to lead a normal life is lifestyle, and eating lifestyle, or food lifestyle, or body lifestyle. And a Super Life product help, particularly in that body lifestyle. So that is one advantage. Then, like what he also said, when he listed the classes of drugs for treating hypertensives, it is glad to tell you that when you are taking Superlife product, the pharmacokinetic action of the components of Superlife product does the same thing like what the drug does. That's why I see some people who were taking Superlife product alongside with normal drugs. After some time, they dropped the normal drugs and they continued with the Superlife product, and it was very wonderful for them because the pharmacokinetic action of the components was also similar to what the drugs could do. So that is just the truth. When you take a stem cell, for example, we have Resveratrol in ST30. Resveratrol is an antioxidant that, what it does, it increases the blood circulation, increases the blood flow through your blood vessels, and it prevents narrowing of your blood vessels. So if you prevent narrowing of your blood vessels and increases blood flow through your blood vessels, it's trying to prevent hypertension. Are you seeing it? So also, some other products also help to nip in the blood calcium from being released. So they prevent release of calcium. Are you getting it? Then they just do practically what the drugs can also do, the same for pharmacokinetic action. So that is how we can also use them to manage hypertension, ST30, SNC. Also use them to manage. Why we sometimes we combine ST30 and SNC? Because hypertensive management involves you doing management on the brain also. You must also do management on the brain. So we're doing management on the brain. With our SNC product, you are helping to galvanize, full, recovery, because your hypertension has a lot to do with your brain. So if it has a lot to do with your brain, and our product SNC has to do with the brain, so you are seeing we target the brain as long as we are dealing with the blood vessels. We're also dealing with the signals from the brain to those blood vessels. So when it regulates that signal, it's also helping to regulate the hypertension. Then, for example, the use of our coffee, what our coffee does not allow your blood pressure to go up. It does not allow your blood pressure to go down. It maintains your blood pressure at that normal level. That is what it also does for sugar. It maintains your sugar at that normal level. So suffice to say that if you are taking our coffee, for example, that superroot coffee, your blood pressure, if it is, for example, 110/70, and you are still taking the product, and together with that coffee, the coffee will not allow it to go below. It will maintain it at that place, and that is a normal value. So that is the advantage. We have advised coffee after you have taken a stem cell for some time. We now advise you to start taking coffee. The coffee will maintain it at that level. So our product is good for hypertension. The only issue we have in hypertensive management, which has made alternative medicine a very good substitute, is because most cases of hypertension are familial hypertension. That's primary hypertension. The hypertension resulting from bloodline factor, that is genetic problem. So that is it. That is why you see hypertensive cases sometimes when they say somebody will be on drug for life, or it is because most of these cases are familiar. So you see genetic problem has to do with the DNA. So when the DNA, it is the code or the structure that the DNA wants the cell to act. That is what the cell acts. So because that bloodline that you came from, that's why we talk about family history. You came from, they are carriers of hypertensive genetic code. So it comes to the children. So that genetic manifestation, it's always there. So see, the person will be taking drugs, but after some time, the hypertension will still come up, the blood pressure will still come up. Even when he's taking drugs, maybe he leaves the drug for like 2 or 3 days, the BP will still go up. Because it is what the DNA say do. That's what the cells do. So, but the good one is that our product helps in facilitating good DNA function. So our superlife products, like the stem cell, works on your DNA. It makes your DNA, that DNA that is now having genetic aberration, it makes the DNA to mimic the one that is devoid of genetic abnormalities. Are you getting it? So it makes DNA to function as if there is no genetic problem. So that is where it has a better advantage than the use of chemotherapeutic management like drugs, because it will help to modulate the DNA function, just as for sickle cell anemia, where we know that the bone marrow is not producing blood well because there is substitution of the amino acid valine for glutamic acid at that position 6. So there's already genetic aberration. So what you will not be seeing the manifestation in the sickler, you will not be seeing shortage of blood, you will not be seeing degenerative pain and all those things. So because the DNA is coding those things. So when we start taking stem cell makes the DNA to function as if those things are not there. So it will mean a normal genetic code. So that is using product, especially for family cases, which pharmacy mentioned, familiar cases of hypertension. Our product will be much more to handle it. So then hairs also have a role to play. We also use our hairs to implement the management of hypertension. We blow it on the head, blow it on the spine, galvanize support on the meridian points. Try to galvanize support, build your immune response system. So it also helps. When you put this all together, stem cell, the terahertz, the neuron care, you see that you have a superb management, and the person will be completely living a good life. So that is the future, because I look at our time is very fast spent. I think we'll draw the curtain from here. We'll just say that few one. Thank you very much, everybody.
Thank you. Yeah, please, friends, please, can we go to the chat room and appreciate all the 3 medical experts that really made this night a huge one, this workshop. Please, can we just go to the chat room and appreciate them? Of course, if they have charged us money, we could have restricted this Zoom that is only when you pay you can have access. But because they volunteered, they didn't charge any money, and they are giving us, look at it, right from Dr. Rove, who opened the floor and laid the cat bare. Then Famachilaka came in that side from the pharmaceutical angle. And Dr. Chooks, who spearheaded the manual, he's the dog that spearheaded the manual, galvanized 4 different consultants under WHO to give us a world-class manual, even though that many of us have never been maximizing the manual. Then, of course, he told us before now that the review is in progress. Thank God for this review, because it's going to capture even the new product that is coming. Yeah, the Rocky Me, God bless you. Oh, Miriam, God bless you. This is from Guinea. God bless you. These are people appreciating our medical experts. Please, I want more people. Yeah, Chimbo Ngozi, yeah, NJ Paradise from Enugu. God bless you. Please, I want more. If it is a fire emoji, release it. We need to appreciate them. You should know from the background where they are coming from. I told us we were in a command, a police command, a starting command in Lagos last week. Dr. Chus really managed these senior police officers in conjunction with Dr. Rove. It was a beautiful day. Uzamaka, God bless you. These are people, I need more, please. 3 of them. We need to, God bless you once again. Yeah. Yeah. More people, more names. Yeah. Eunice, God bless you. Please, I'm waiting. Godfrey, God bless you. God bless you. These are to the 3 specialists that God gave us at this point in time. Essence, Samuel, God bless you. Thank you. These are going to our able medical experts that has really volunteered themselves, sacrificed their time, their everything to be with us every Friday like this. God bless you. Sorry, 10 news. 10 news, God bless you. Yeah, thank you. More people. DK, God bless you. Yeah. So, Doc, I want to please use this opportunity to invite us coming Friday. Dr. Chus is going to have a full-time workshop on terahertz. On terahertz. Oh, sort out. Yeah. Well, wonderful. This is a powerful fire emoji. God bless. Steady. God bless you. So this Friday, I'm not just inviting you. Please, if you know those, there's a lot of people that are having terminal health issues, chronic health issues. Let them be on the platform. Let them be on the platform. Invite them. If there are some of them, if they don't have a Zoom app, show them how to connect. Make sure that they motivate them to find somebody that they will connect and watch about the terahertz. That is another paradigm shift in the medical world. Very powerful paradigm shift. I don't need to, you will hear it from the horse's mouth. Thank you. So please don't miss tomorrow. Tomorrow is on a wealth creation, financial freedom, time freedom, financial freedom tomorrow. You could see that we started this from the foundational level. From the foundational level, we are not even talking much about super life comp plan. No. That one take a just small percentage, maybe 10%. The whole 90% will be dedicated on that foundational wealth creation principle. By the time you and I are done with this foundation, wealth creation foundation principle, watch and see. Sky is going to be our beginning in the area of wealth creation. You will be, you will begin. Your system, your aura will be attracting. You know the way magnets attract metal, meaning that you are no longer you won't be pursuing wealth. You won't be pursuing money. Money will be locating anywhere you are. Money will be attracting you anywhere you are, because the aura that is living out of you is a magnet. Wherever you are, they will locate you. So please don't miss it tomorrow. We have a seasoned coach for it, and those of us that have been in some previous Saturdays now can attest for it. So we have a seasoned coach to lay this foundation once and for all, so that we can no longer be running from post to post. No, enough is enough. Thank you. Yeah, for this tonight meeting is a time well spent. I believe that you really have the value of your time being here. So I want to appreciate those of us that are still standing on before we share the grace. Those that are network are still still standing to the closure. I want to thank Dr. Chus. He's still on the room. Dollarfield is still in the room. Dr. Ebe Rostella is still in the room. Fam Chilaka is still in the room. I want to appreciate you. Samson, the coach Samson, is still in the room. God bless you. Anthony, Barrister Indio, God bless you. Basam, God bless you. Chichi, God bless you. I'm still appreciating those that are still in the room. Yeah. So please, tomorrow is another night. Tomorrow night is another night. Don't miss it for anything. We are still having Eunice, God bless you. Grace, God bless you. Malachi, God bless you. Miriam, God bless you. Mary Ann, Ebe, God bless you. Mama, God bless you. Godfrey, God bless you. I'm seeing Ogun 17, Yaya President, God bless you. Prince Ade, God bless you. Sort out, God bless you. Tenus, God bless you. Ozamaka, God bless you.
Do you have any question?
Any question on the chat room? Okay, yeah, good. Coach Sampson, please, can you check the chat room? If there's any question, please. All our medical personnel, they are still to attend to our questions. Please, is there any question, or you can raise up your hands so that we can permit you to unmute your mic. First one, if you have any question, please raise up your hand so that you can ask your question. Anybody? Okay, no. Coach Sampson, are you there? Any question in the chat room? And is anybody raising up his or her hands? Nobody. Okay, that is to say, thank God. That is something. The message, the workshop really is really digested and assimilated. God bless us all. Can we?
Somebody say, what is the combination for spinal cord injury?
What is what?